Time now for Morning Rounds, our look at the medical news of the week. Heart disease is the nation's #1 killer, and a new study says many who appear to be living healthy lives could still be at risk.
The study appears this week in the Journal of the American College of Cardiology. It included nearly 1,800 participants without traditional cardiovascular risk factors. That means, among other things, they were non-smokers with normal blood pressure. The study sought to identify predictors of a sometimes hidden risk factor, plaque buildup in arteries. Here to discuss the findings is CBS News medical contributor Dr. Tara Narula. Doc, great to see you.
Good morning, Alex.
So what are predictors of plaque in the arteries?
So one of the holy grails in cardiology is trying to predict who's going to have a heart attack and stroke before it happens. Because the problem with cardiovascular disease is that it can be silent until you have an event. So what do we use? We use traditional risk factors like do you have high blood pressure? Do you smoke? But what this is telling us is that that may not be good enough because in fact, 50% of those who had normal traditional risk factors had plaque in their arteries, and not at age 70 or 80. These were 40 to 50-year-olds. 1/3 of those who had optimal risk factors had plaque in their arteries.
Wow.
So what seemed to matter in this study was being a male, age, and LDL. So this is kind of the big finding of this study, is that LDL, or bad cholesterol, may hold the key to why young people who seem otherwise healthy may be having heart attacks.
All right, so as this study focuses on our artery health, what should we take away from it in terms of preventing this?
So again, it comes back to what can we really control partially, and that is cholesterol. And so LDL, there's been a lot of controversy. Well, does cholesterol really matter? Well, it does. We have a lot of research, and here's another study telling us that not only does it matter, but it matters to pay attention early. So everyone should start getting screened. They should know their numbers as early as age 20. And what the other interesting thing about this study was that even LDL numbers that were considered normal, meaning like around 150 to 160, about 60% of those people had plaque in their arteries. So really, it seems that once you go above an LDL of 50 or 60, which is pretty low, you start to develop plaque. So pay attention to diet, exercise, weight loss, that matters.
All right. Next up, still on the topic of heart health, but this time affecting newborn babies. Some states have implemented mandatory screening among all infants for what's known as critical congenital heart disease.
A recent observational study published in the Journal of the American Medical Association looked at the impact of these screening policies. Researchers examined data from 2007 to 2013 looking at infant death rates. They found that nearly 3,000 infant deaths resulted from critical congenital heart disease. The study assessed whether states implementing mandatory screening guidelines saw declines in death rates. Okay, that's a deep tease. Did they see a decline with these screenings?
They did. And Alex, you just had a baby. I mean, you know, one of the first things you wait from the delivery room, the cry, to know the baby's okay. Then before you get discharged, did they pass their screening tests?
Yeah.
And the screening test for critical congenital heart disease really became recommended not that long ago, in 2011. And so when they looked at 8 states that kind of changed their recommendations in this time period, they found a 33% decrease in infant deaths from critical congenital heart disease and a 21% decrease in infant deaths from other causes, unspecified cardiac causes. We know that 7,200 babies a year are born with critical congenital heart disease, and you need to pick it up early because even though they may look healthy in the hospital, when they go home, those first couple days and weeks, they can be at risk for cardiac collapse, for dying. But picking it up early means they can get really diagnosed, they can get treated with either surgery or the procedures that they need.
Wow, it's a game changer.
And it's a simple test. It's called the pulse oximetry test. All it's doing is measuring the pulse and the oxygen level in the blood of the baby.
All right, Dr. Tara Narula, thanks so much for being here this morning.